జ్ఞానమూలం గురు పూజామూలం గురుర్పదం మంత్రమూలం గురుర్వాక్యం మోక్షమూలం గురుర్కృపా మోక్షమూలం గురుర్కృపా. హరి ఓం హరి ఓం all. So on behalf of Shivadarshan Yoga Vidyalaya and our Swamijis, we welcome all of you for this session. This is a very special course because without knowing anatomy, physiology, it's not easy for a yoga teacher to do even self-practice or to get into therapy. So this course is uniquely designed, and we have our teacher, Kadambari ma'am. Hariyo ma'am. She's a senior most teacher at Shivadarshan Yoga Vidyalaya and has a lot of knowledge about anatomy physiology. You ask yoga, you ask any related to therapy and anything related to anatomy physiology, she can answer and help you out. So before getting into the course or this first class, we will spend 2 minutes to understand where we belong, from where we are studying about our ashram. I will share the screen now. These days, you can see n number of yoga institutes, yoga studios. So we need to understand a little bit about our ashram. You can see here list of the photos of gurus. This is our lineage. So first is Swami Shivananda, then Swami Satyananda, who is the founder of BR School of Yoga, and we have Swami Nirajanananda, who is now heading BR School of Yoga. And below you can see our Swamijis. So both of our Swamijis are direct disciples of Swami Satyananda Saraswati, the founder of BR School of Yoga. Swami Vajrapani is the founder of Shivadarshan Yoga Vidyalaya, and we have Swami Gambirananda, who is Acharya at Shivadarshan Yoga Vidyalaya. The uniqueness of our Swamijis is here Swami Satyananda chose our Swamijis to take sannyas and get into the spiritual dimension. So as per the guidance and instruction given by Swami Satyananda, our Swamijis came to Chennai and started this institution in spreading yoga door to door, shore to shore. So we have around 6,000 square feet of area in Chennai. If you happen to come to Chennai, please visit our ashram. You can meet our Swamijis. There are online and offline courses happening at our ashram. Of course, mostly online and few offline courses. So this is a trust. It's a 100% charitable trust, Shivadarshan Yoga Vidyalaya, and it's kind of not a regular yoga studio. So this is run and headed by a group of trustees headed by our Swamijis. This building where we are was inaugurated by Swami Nirajananda Saraswati in the year 1999. And after a great effort from our Swamiji, Swami Gambirananda, we got recognized as a Yoga Therapy Research Institute by DSIR, Department of Scientific and Industrial Research. So what we do for this, we do yoga therapy regularly. We take a lot of research we do, and we submit this to DSIR, and we keep on renewing this. This is for just for social cause we are doing. We have also become the associated center of Indian Yoga Association. All of you might be knowing Indian Yoga Association, which is the common body which unites all the traditions. And our Swamijis, both our Swamijis were honored with the title Golden Swamiji by BR School of Yoga in 2013. So we crossed 33 years. We are into the 34 year now, running the institution, and both of our Swamijis with a 100% service attitude. This institution is run purely to spread yoga door to door, shore to shore. These are our flagship courses. You can see right side anatomy, physiology, and we have Nadi Shodhana, Pranayama, Chakra awareness, Manipur Chakra, and all those things. And we have teacher training course in yoga therapy, TTC 1, 2, 3, and we have kids yoga. Kids yoga means this is also for teachers, yoga teachers, to become kids yoga teacher. You may be a normal teacher, but how to teach kids? If you want to become a kids yoga teacher, you can join that course. Other TTC 1, 2, 3 are yoga therapy teacher training courses, which are dealt in detail. You can see a vast practical application will be teaching with a very good amount of theory so that you can have best of both the worlds. And all these courses have yoga nidra and meditation as a common subject, because Yoga Nidra and meditation can be applied, can be given to anyone, especially Yoga Nidra. If somebody cannot do asana pranayama, we can give Yoga Nidra for it. So TTC1 covers 4 important ailments: high blood pressure, diabetes, asthma, spondylitis. TTC2 covers menstrual disorders, thyroid, PCOD, prolapse, and menopause. And TTC3 deals with pregnancy-related, prenatal and postnatal. These are the many VIPs who visited our ashram in the past. We have Swami Chidananda Maharaj in the center, right side Swami Nanananda Saraswati, and left side bottom you have Swami Vijayendra Saraswati, and many people who has come and helped us to spread yoga everywhere. And we have a much bigger facility at Tiruvannamalai where we visit quite often. We have a larger facility to conduct yoga classes and all those things. One important thing about doing course here at Shivadarshan is once you finish the course, you become part of this alumni group, and you'll be in a group where Swamijis are there and our teachers are there. You can always get any kind of assistance from ashram. So we'll get into the session. Hari Om Kadambari ma'am, kindly take over session.
Hari Om Balamurali sir, it was a very nice introduction. So nice. Okay.
Okay.
Please mute yourself. I will share my screen now. Are you all able to see my screen? Just give me a thumbs up.
Yes, ma'am.
Okay. Okay, Neelamaji. Thank you.
Yes, ma'am.
So the first class is going to be an introductory class. So I wanted to tell you what you will learn, who am I, so all those things will be there. So today we are going, you guys are in a very important course. If you guys are choosing any kind of healthcare profession, this is a very important course that you have to know. This is the basic of any therapy. It can be yoga therapy, it can be homeopathy, it can be allopathy, or it can be allopathy. They will learn anyways. First year fully they'll learn anatomy and physiology, and they'll be hands-on to it. And then they will have, even if you are going for a naturopathy, you have to learn this. Even if you are going for acupuncture, even though they learn about all the points in your fingers and things, you have to learn anatomy and physiology, without which you cannot do any form of therapy is not possible. Okay. I hope that is clear. If somebody wants to learn any kind of human, if they are going to deal with a human being, they should need anatomy and physiology. One thing you should understand is we have a beautiful body, right? We are all born with beautiful body, and the body can heal itself, right? But it is an instrument. Think that you means I'm talking about the energy that is within our body. We have a beautiful body. It's like it's an instrument, right? Everybody should know how to operate the instrument, right? So this is a manual. You need to know you have a body and you are in it and you are just driving your car and everything, but you should know what is there inside your car, why it sounds different, what happens and all those things, right? So the anatomy and physiology is like a manual for your body, right? You should, without a manual, what will happen if something happens to you? You will try to fix it, but it will be like a different, it'll go into an adverse effect. So you should know how to fix it. For that, you need a manual. So that's what this course is all about. This course is all about how your body functions, what is there in your body, and what is this is a manual for your body, right? I think I'm sharing, right? You're able to see my screen?
Yes, ma'am.
Oh, give me a minute. I'm not able to see my screen. Okay. 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 For some reason, I'm not able to see you guys. Wait a minute. This is okay. Okay. So now, who am I? So I am a yoga PhD scholar, and I have done medical coding for 16 plus years. Now I'm almost there. I'm almost there for 20th year of my career. Okay, that's my expertise. And what is my expertise is I do surgical coding. Does anyone know what is medical coding?
No, ma'am. Please explain.
Okay. Medical coding is nothing but medical coding is a minute. Why am I not seeing you guys? Okay. Medical coding is nothing but the in US healthcare, what they do, the providers do a lot of documentations before they send it to the um, everything is number based. So what they do, they just talk or they just give some medicines, they do surgeries. All those things will be in documents, right? So our job is to make them in numbers. So you have to know in and out of your body to put them in numbers. So it's a different kind of language by itself. So it will go in numbers. Each numbers will carry a set of revenue for that procedure. For example, if you guys are going for a outpatient visit, let's say you have a fever or you have some kind of like your ear is aching or you have any kind of surgery, appendicitis or something like that. So you go to doctor, right? Here in India, what they do, we pay. We pay from our pocket or we just charge the insurance company. We don't use any kind of numbers or anything. And the insurance companies are in such a way that they just reimburse you. You just give the disease by itself and they reimburse you. In US, everything is automated. What they do is they will say, I saw this patient for this many minutes, like say 30 minutes. Or he'll say like, there is a problem with this patient. This patient has got blood pressure. I have given him medication for that. So what we do is we take that visit and then we'll code. So this patient was there in the office for 30 minutes. The provider spent 30 minutes with them. So what we do, we'll give a code. It's 99213. That's an evaluation management code for 30 minutes visit with a medium medical diagnostics. That means the patient has high blood pressure. That has a ICD-10 code by itself. That means in the International Classification of Diseases, 10th edition. So you have to code for the disease and you have to code for the visit. So this will be getting paid. This is how medical coding works in US. So you have to, when they do a surgery, how they went inside your body, what was the placement of the what was the placement done inside your body? If they are putting a like what to say, if you're having a hernia surgery. So if they're going to put a mesh inside you, how did they get it? Did they use a laparoscopy or how percutaneously how they went it? All these things will be coded in numbers. This is the whole point of medical coding. You understood what it is? So what I can't say like we have to know anatomy and physiology in order to code. So it's a healthcare profession, but it is in the financial side. But you have to know for medical coding, you should know anatomy and physiology. So this is what I do for past 20 years now. Okay. This is how we do. And along with that, what I do is I'm an expert in yoga, mudra therapy, and I'm also a Reiki practitioner. I'm a YouTuber. I create content on yoga, health, and wellness. And I'm a holistic wellness practitioner. I'm into research. You all know that I'm into research now. So Why do you need anatomy and physiology in healthcare? What is the why anatomy and physiology matter in healthcare? What is anatomy? Anatomy means structure. It does the structure of your bones, muscles, and organs. Physiology means functions, how those parts work together. Healthcare professionals need this because it helps them to interpret the symptoms, body signal accurately. It guides safe treatment decisions. It prevents harm, wrong movement, pressure, or intervention. It allows personalized care instead of one size fits all. So you cannot give the same treatment to everyone, right? Each person is different. Each experience for a person is different. So you have to go with the flow. That's why you need to know anatomy and physiology in and out. And then the next thing is, whenever you get let's say you get an X-ray or you have a medical document that you have to read. So how do you read it? Do you know how to read a medical document? When you learn anatomy and physiology, you will know how to read a medical document. So how to read a medical document is nothing but you have to know how we go, from where what is distal, what is medial, what is proximal, how the body has been like segregated. That you have to know. So if they say that there is a tumor, for example, in your breast, and they'll say like it is in the anterior portion, posterior portion, or they'll say clockwise for 6 o'clock. They'll say 12 o'clock. So all these things you should understand. Then only you will know there is a problem, how to fix it, how they will give treatment for. You should be like informed and you should be aware of what is happening within your body. So for yoga, why is anatomy important for yoga? Yoga directly interacts with the body system, right? It works with the muscular system, skeletal system, nervous system, respiratory system, and endocrine system. Without understanding them, teaching or practicing yoga becomes very, very risky. What happens if you give a patient who is having a spondylitis, you're giving a asana, and he keeps saying that it pains, but you still insist him to do it? What will happen? This session is going to be interactive. I want everyone to talk. So what will happen if you keep on insisting, if there is a pain or if there is something that person has some back issue, what will happen?
The pain increases or it become an injury in that body.
Yes. What will happen is the pain will increase.
Risk of injury.
Risk of injury, right? So what if the risk of injury can be avoided when you understand how you should change the postures for him? There will be the main idea of a yoga therapist is to get rid of the pain, right? It should not aggravate the pain. Correct. So you should understand how to manipulate the person so that he will come to the same, he'll do the posture, but without any pain. He has to go there. That is the end goal of a yoga therapist. But he should be able to tolerate and he should be able to, do usually what we say, you have to stop. You don't give these yoga asanas, we'll say, right? But you have to, give some transition for him to understand and do it in a proper way. So that means you should learn how to, what is there within him that we can fix, right? For that you need this thing. So what happens is overstretching of ligaments, compressing the spine, all these things will happen. Okay. Now are you guys seeing this posture? Wait a minute. Share it. Okay. Are you guys seeing the posture here?
Yes.
ma'am.
Okay.
Yes, ma'am.
Do you think that this person is doing it correct?
No.
No.
What is the difference?
The elbow should be bent little bit and his navel should be touching the ground.
Okay, then
The muscles at the chest region is stiff.
yes. Who is that?
Sudha.
That is the right answer actually. See, you can keep your elbow straight. That is that is also okay. That's an advanced level of Bhujangasana. And then the muscles at the shoulder level is too tight. Can you see that? The chest and the muscle, this is wrong. What will happen if he keeps doing it? This is a right posture. Then one more thing is the knee is getting hurt. Did you see that he is standing on his knee? That is a posture where you can go like, on the foot and then the knee is also hanging. That is also a posture like that, right? That he can do. But that is wrong. What you have to do, you have to put your thighs down. Your spine is completely curved. Did you see that? This is the right posture for Bhujangasana. All these things you should know. Then only if a person is having a elbow pain or a shoulder pain, what you will do? You have to put them in Sarala Bhujangasana, right? All these things you should understand. Only when you understand the body, you can, tell them what it is. So again, same thing again and again it is repeated. So when you learn therapeutic yoga, your knowledge of that body is different. It is, you will you will be in a different level and you will understand them better when you give them, when you can see that when you give them therapy, you will see result faster because you are not doing mind game. You know exactly where the problem is. You are trying to fix the problem. Okay, in this picture, this person is adjusting, right? This person is trying to correct her. Can you see the difference between the right posture and the wrong posture?
Yes.
What is the right posture? What we have to do? Eventually,
Front picture is there.
front picture is also not right actually. The
Yeah, the
end goal
heels
is
are
this,
up.
like heel
Yeah.
should be touching the floor. In order to heel to touch the floor, you should give some time, right? So slowly she has to go there. But the head is in the right posture. So slowly she'll go there eventually. But this person is putting the head up. This person is also putting the head up. So that confidence, to correct the postures, that confidence should come. So what we are going to learn when you come to yoga and anatomy, we know many things, right? We know that the parasympathetic nervous system is going to get activated when you do pranayama. We know that the hormones and the moods and everything is going to enhance. But how it's happening? You have to know scientifically how body and minds are connected. This is very, very important. That's why we are learning the course. So we have, you saw, just now Bala Murali sir said, we have different age groups. We have yoga for kids. We have yoga for TTC. One is for the diseases, like the common diseases that we have. TTC 2 is for women health. And TTC 3 is for prenatal and postnatal. For all these things, in that particular point, you should know how the body works. Age-wise, you should know. And then injury history, you should know. If somebody is having a slip disc and you are asking them to do forward bend too much, what will happen? The risk of injury is high. They will also end up in getting sciatica, right? So you should know all these things. Okay. You should know the medical condition. You cannot give head like migraine patient Sirasasana. What will happen? The headache will become more, right? So all these things you should know, how it works, how We can, with the medical condition, how you can put them in Sirasasana slowly. That I'm not saying you should absolutely avoid. You can put them. If they want to do, they can do. But you have to transition them in a very slow pace. So what you will learn in this course? So you're going to learn about the basics of bones, muscles, joints, how it functions, how it works. Then major body systems, movement of science in yoga, posture, alignment, pranayama, like breathing techniques. When they say pranayama, breathing techniques, how it works, how you can give them for different disease and conditions. All those things you're going to learn. And for each system, you will be learning what are all the common diseases that you see. Skeletal system, arthritis, all these things you learn. In muscular system, muscular dystrophy, all those muscles, what are the systems, what are the problems that you see in nervous system, what are the problems you see in respiratory system, asthmatic, all those things you learn. Circulatory system, high blood pressure will be there. There will be cardiovascular diseases. We'll learn all those things. So these are all the major body systems that we are going to understand and learn, and special senses also we are going to see, which is nothing but your eyes and ears. Very, very special sense organs which we have. From this only we are understanding the world, right? Eyes and ears. But these are two major sense organs that we interact with the world. So that we are going to learn. So all these things we are going to learn along with the disease. Okay, what are all the common diseases that comes from? And then if you have any questions regarding the disease that you already seen in your family or friends, that we will also discuss. That will be discussed in the class. These are all the major. I wanted to show you pictures of how it is. So that's why it is here. And at the end of the class, what you're going to do is you're going to understand your body and transform your practice as well as transform your teaching. Okay, in a very practical way, and turn yoga into a healing tool. Thank you. If you have any questions, you can ask me. No questions, huh? So did you understand what we'll go through? Okay. So how many of you already signed in for the class? Chat window, somebody's asking. Okay. So if you have any question, please go ahead. You can ask me. I'll answer you.
Madam, it's a 1 hour class, right?
It's going to be like 1.5 hours class. I'll start at 8 o'clock and I'll be finishing at 9:30.
And in case if there is emergency and we miss a class, what will happen?
We will record the session. Even today, I'm recording the session. So the recordings will be available for you, sir.
Okay.
So
What is the last date to join this class?
I think today.
Today.
Yeah.
Okay. Okay.
Okay. So you can join today. We'll also discuss. See, I am a yoga mudra therapist. I designed a mudra therapy course for Shiva Darshan. Myself and one of my friend, whose name is Viji, we both take mudra classes also. So we'll be you'll get a combination of everything with me. That's what Balamurali also told you, right? So we'll see holistic wellness, how we can, provide a holistic wellness for your practice. As well as if you are going to be, how many people are yoga, practitioners and therapists here? Teaching yoga, okay. Shahini, Neelima. Then who else is there? Sudha. Sudha, are you a yoga therapist?
Yes, ma'am.
Okay, Sonali. Okay, I think many are here.
Yes, I do teach.
You do teach. Very good.
So, ma'am, I just wanted to know, you asked whether we signed in. Sign in means like joining the
Course.
regular. courses. So is it something else than just coming on to the Zoom link, or is there any other way to sign in
I think
for the course?
for the class, I think you have to check with Balamurli or Pushpalata for that.
Okay,
So they will be able to help you.
fine.
Pushpalata is also here. Pushpalata,
Ma'am.
is it a different link to join in?
Hariom,
Hari-
ma'am. Yes, ma'am. We will be creating a new group
Okay.
called Anatomy and Physiology group, WhatsApp group, with only registered students, and we will be providing them direct link.
Okay. So those who are interested, they have to first register through the link that we will share.
Yes,
Thank
you have to give your personal details and make the payment, and a few registration process such as filling up the corpus form and the Google form, and then you are registered in our course.
Okay, thank you.
What is the cost,
I
ma'am?
think somebody Samsung SMA336P was like, holding his hands up.
I just want to know what is the cost of this course?
Pushpalata, do you know the cost of the course? Nitin is
Yes,
asking.
it is 4,000 for 10 classes, ma'am.
Okay.
Indian rupees. And if anybody from abroad joining the course in this group, anybody from abroad? Hello, am I audible?
Yeah, you are audible. This group is very silent. They're not talking, Pushpa.
Okay. Okay, ma'am. I hope then everybody are Indians only. So they are charged 4,000 rupees for the course.
Madam, 4,000 fee.
Yes, sir.
Today is last date for join, ma'am.
Yes, sir. We are starting. Ma'am will start the first class, and you can start registering maybe tomorrow, today, or the coming week. That
I
is by
just gave
Monday or
an
Tuesday.
I just gave an introduction. Officially the class will be starting like next week onwards.
Okay.
Thank you. Is it 1.5 hour class, ma'am? Every Saturday?
Every Saturday, 8 to 9:30.
9:30, okay.
Ma'am, how to get the payment link?
Pushpalata, you're talking in mute, ma.
Ma'am, am I audible now? I'm
Yes,
typing my number in the chat box. Please make a note of it, and please send a message. I can send you the payment link. Here is my number. I'll put it in the chat box.
So whoever joined this class now, I just wanted to know what they are doing. So we'll just check with them. We'll finish up. Somi Shetty Suri Baba.
Ma'am, tell me.
So what are you doing, sir?
Previously, I had done with this institute Kids Yoga, ma'am.
Okay.
Now I completed my yoga therapy course from Vartman Yoga. I completed level 1 Ayush instructor course, protocol instructor. Now I'm doing level 2.
Okay.
It may be in exam in June or July.
Okay.
Yoga diploma also I completed, ma'am.
So you are into yoga, yoga
Now
field.
I'm doing mudra therapy also from one of institute in Hyderabad. It's international recognized course, YSC course.
Okay.
It will complete by end of this month.
That's good. So what about others, Sudha?
I did yoga therapy TTC2 from this institute, and I am a yoga therapist from Ayush. I did level 6.
Okay.
I am teaching as well as I'm a practitioner.
That's nice. What about Sahini?
I have completed MS Yoga
And also pre and postnatal teaching yoga from Civilization Yoga Session.
MSc, where did you do?
Annamalai University.
Annamalai University. Oh, yeah, nice. Venkatachalapati sir will be there. He
Yeah,
retired, right? I did
yeah,
my
retired.
PG diploma in yoga therapy in Annamalai University.
Oh, nice.
Sri Satish Sundar.
Hi, ma'am.
Hi.
I completed MSc in Yoga in Annamalai University and Diploma in Yoga in Tamil Nadu Sports University. And I completed a YCP Level 3 exam.
Okay.
And I'm currently teaching yoga, ma'am.
Super.
And I'm
So
working in an IT company.
you are sports university student, huh? I'm doing my PhD in sports university.
Yeah, Diploma I completed in a Sports University. And
Okay.
MSc I completed in Annamalai University.
Okay. Good. What about Neelima? Neelima ji, are you there? I'm just trying to get to know each other. What about Sudha Gupta, Neelima? And the Samsung, I'm not sure who this is.
Hariom, ma'am.
Hariom.
Ma'am, I am from Mumbai. I have done my yoga teacher training course from Sri Sri University, Cuttack.
Okay.
Then I have done level 2 and level 3 from YCB, Ayush Mantralaya.
Okay.
And prenatal and postnatal therapy course from Shivadarshan Yoga Vidyalaya.
Oh.
Now
So
I'm teaching. Yes, ma'am.
So you are
Yeah.
part of Shivadarshan.
Yes, ma'am.
What about Somali Oh, she spoke, right? Just now she spoke. Soma Sundaram, sir. Sonali, yes, go ahead.
Yes, so I've done my yoga course long back from Munger, 99, 2001. And from then onwards, I'm in teaching yoga.
Super.
So,
Good.
yeah. So now in Chennai for the last 1 year. And I'm in a school. I take classes for the children.
That's nice. Nice. So you guys will benefit a lot from anatomy and physiology class actually.
Yeah. I've noted down Pushpalataji's number.
Okay.
Thank you, ma'am.
No problem. What about Simna? Soma Sundaram, sir. Simna, yes, go ahead.
Ma'am, I'm from Kerala.
Okay.
I'm MSc Yoga and Geriatric Counseling from Mahatma Gandhi University.
Wow. Geriatric counseling, huh?
Now I'm as a yoga teacher and a counselor in an old age home.
Oh, that's nice.
And then also doing classes in online. That's
very nice. So you are familiar with anatomy and physiology then?
Yeah, ma'am. I'm almost familiar, but I want to study more detailed.
That's good. The yoga side you need to know, right?
Yeah.
How to give and all the things, yes. Okay, Samsung, yes, Sam, please go ahead, talk, and then you can leave.
Hi, yeah, namaste. So, I'm Amita and I'm a housewife. I want to learn for myself.
Okay, that's nice. That's nice. Yes, everyone should learn anatomy and physiology because we have as I said, we have a beautiful instrument that we need to know how to use it, right? So we just keep on doing something or the other and we just leave the symptoms off. So we should know what symptom is arriving from where. So that we have to understand.
Yeah, thank you so much. I'll leave. Huh? Thank you.
No problem. Did I miss anyone?
Ma'am, I want to know one thing.
Yes, sir.
Ma'am, completion of this course, there is any exam or project work?
Actually, I know, whenever it comes to anatomy and physiology, people get scared because of the words and things like that. If you want to write exam, you are most welcome. I will prepare paper. You can write the exam, and then you can get the certificate. I'm not sure what Swamiji is trying to do this time, Last time we didn't have exam, but mostly before the previous thing, I was the one who was correcting the papers. We had an exam. So last time there was some, something was there. So we didn't have exam then. So I think it's better you guys have an exam and.
Why? Because I am asking, I am doing occupational course from Aspas University, Prayagraj. As at that time, June 13th, 14th, I have some two exams. Maybe dates with clash at the time, same time. It will. That's why I'm asking, ma'am.
I think it's up to you whether you write the exam or not, but check with Pushpalata. She'll be the person to help you with that.
Okay.
Pushpalata, did we plan for exam this time?
I don't think so. Exam is, 1 second. I don't think so. Exam is planned for anatomy and physiology, ma'am.
Okay, it's just a
I'll
knowledge.
Yeah.
Okay.
Will you provide a certification after completion of the course, ma'am?
I shall get back to you, sir. Please
yeah,
message me.
Yeah,
Please message me over the phone,
Yeah,
personally in the WhatsApp. I shall confirm it to you today, sir.
Yeah, ma'am.
We'll provide for anatomy and physiology, that is certificate. I know that, Pushpalata, but check with Swami Jash. They provide certificates.
Okay, ma'am.
Thank you.
Sure.
Anything else? Yes, Pankaj, you have anything to say?
No, ma'am. No, ma'am. Everything is fine, ma'am.
Okay. So, I think we are done with the class. If you have any questions, please go ahead. I'll clear it. Then we can start the class from next week onwards.
Ma'am, ma'am, can provide a notes or a text to refer?
Yes, every single system will have a notes. So you will get 11 notes of anatomy and physiology with you. With one more, like 12 chapters will be there. So I'll be covering 12 chapters, each chapter in detail. Sometimes we might even extend the class for next week because we can't complete the one system in 1.5 hours. Is very difficult to process. And my classes will be very interactive. I'm not the person who just gives and leaves. I'll ask you questions. It will be very interactive and I'll make it interesting because anatomy is a very dry subject. We have to just go on because you guys are not doing anything practical. So what will happen is I'll be teaching you terminologies, like, how to form words in, medical field, how they form words, all those things I'll be teaching you. So it's going to be a little dry. So we'll be doing interactive sessions. So, and for every, once I finish the chapter, you will get a notes. So for every system, you will have a notes. With this notes, if a person is doing first year of medicine, they'll be able to clear their anatomy paper. That I can guarantee.
Okay, ma'am. Thank you.
Okay. And if you have any questions or any doubts, you can always contact me. As I said, it's going to be an interactive session. So you can always contact me for that. Okay, we'll see holistically how, since you guys are a yoga practitioners and you want to learn more about holistic wellness programs, we'll also talk about what kind of diets can be given, what kind of mudras can be given, how we can not treat certain conditions like that. Okay.
Okay, ma'am.
Did I talk with everyone? Okay, 11. Anything else that you guys have?
Nothing, ma'am. All fine.
Okay, super. Super, sir. Nitin, who spoke now? Pankaj.
Yeah, me.
Pankaj, what are you doing, Pankaj? Where are you from?
Ma'am, I'm based in Bangalore.
Okay.
And I was a student of Swami Gambhirananda.
Okay.
But very regularly irregular. So just interested in yoga and wanted to learn about this all.
Oh, okay.
So I'm joining, ma'am.
Okay, super. So how many of you are joining? That I'll know only tomorrow.
Me, I am planning to join, ma'am.
Okay.
I already registered.
You already registered. Okay.
One of my yoga therapy teacher also will plan to join, ma'am. Now she is busy with some work. That's why she can't attend this webinar.
Oh.
Madam, can I leave? Is there anything else to discuss about?
Nothing else, sir. You can leave. That's okay.
Right.
So,
Thank you. Thank you so much, madam. Hari Om.
Hari Om. So one thing is, one thing I wanted to tell you is like, I'm into medical services, allopathy, healthcare system. I know how, the medicines are given, certain procedures are done. So that's why I came to yoga. So some people will be treated unnecessarily. You can be just cured within 2 days rest, but they'll be given medicines, all those things will happen. And I still remember I had a provider. See, she was very sweet person. In US, we can't do that. That becomes an abuse, actually. She's an Indian. What she does, she is a pulmonologist. What she will do, whenever a patient comes in, she'll ask them to take an X-ray first. Okay. You have to see the patient. For me, those X-rays, I couldn't bill her. You know why I couldn't bill her? The reason is she never saw the patient. She just ordered an X-ray, and then she didn't know that can be done, because in India we do all those things, right? So she thought it's the same thing in US too. So what she did, she just ordered X-ray, and almost like 4 or 5 patients she ordered X-ray, and I was like surprised. You never saw the patient. How can you order an X-ray? This is what my question. She was saying, no, they said lung congestion. So I wanted to check their lungs before they come in so that the diagnostic becomes easier. I said, no, you have to put your stethoscope on them, hear their murmurs, then you order an X-ray. Because here it doesn't work like that. If you order an X-ray before, those visits, those X-rays, you cannot get reimbursed. Done. We had to write off like 10 to 15 X-rays because she ordered without seeing the patients. So this is a small thing that I'm telling you how Indian doctors work. They just depend on instruments for diagnostics. So you have, when you know how it is, like, I'm not against them. Again, I'm just telling you have to, in US, we have rules where we have to follow. Here, there are many cases of, C-sections in India. This is a general thing that everybody knows. And US, no. They'll wait for 2 weeks, even after you're due, until you get a pain. If there is a problem, if the baby has any problem, or if the person who's trying to deliver has any problem, then only we'll go for a C-section. Until then, that has to be medically clearly mentioned in the chart that there is a problem. That's why I'm going for C-section, like that. Or sometimes the patient will opt for C-section. That's a psychological ask. If they note that also, they can go for C-section. Without that, no one is going for C-section without them trying for a normal delivery. That's a rule. So, and another thing also, if a person is having now we all have the health checkups, right? Like major health checkups. Every year, the insurance company is asking you to go for a full body checkup. The full body checkup sometimes turns into a pathetic, they'll put I had my own experiences there. I have my husband is here. Last year, we went for a whole body checkup. So he went for a treadmill test, and they said he has there is some abnormality on his treadmill shift. So what they did, they just took him, they said, you have to go for an angiogram. So we all went he didn't have no symptoms. He is absolutely fine. He's a very healthy person. We went for an angiogram. They said he has multiple blocks, not one or two. He has like almost like 20, 21 blocks. Okay. But he is functioning normal. He didn't have any issues, no problem, no chest pain, nothing. So in US, what we do when they have multiple blocks, they should have some symptom, right? They will have either chest pain, chest, pressure, or any kind of breathing abnormalities. So that will be there. Nothing was there. This doctor was telling we have to do a bypass. Okay, a healthy person with multiple blocks, but he is fine, absolutely fine. And he showed me the chart. See, if a person who doesn't know anything, what will happen is they will get scared first. So he was showing me the blocks. I said there are collaterals. There are blocks, but the heart has its own way to find its way and provide blood supply to the arteries have already been formed because it's been there for a long time. So I was showing him, so yeah, there are collaterals. Yeah, he said, yes, there are collaterals. Then why do we need to worry? He said, no, we have to do, because he has multiple blocks, we have to do bypass. I said, why are you making him a patient? Once they do a bypass on him, I have to take care of him rest of his life. It'll take 6 to 7 months to recover. Again, he can't run, he can't walk, he'll have a lot of abnormalities. I said, why are you trying to make him patient? His quality of life will go down. Now he is fine. Then he was saying, at least we'll put one stent. Okay, on the main arteries. I said, you just said we have multiple blocks. Then can you go inside, all the small arteries? He can't put stents there, right? I was asking, so there are blocks only in the small arteries. Can you do a stunting there? He said, no, that will become dangerous. So you should, I avoided all those things. My husband is fine. He started walking, previously he was walking 6,000 steps. Now he started walking 20,000 steps a day. And he's absolutely fine. He doesn't have any issues. So a major problem, what happened is we stopped it because of your knowledge, right? Otherwise, what will happen? By now, he would have had a bypass. Whoever sees him, his case, once they write a coronary artery bypass, CABG, what will happen is you go to any doctor, they're going to tell you coronary artery bypass. No other choice. That's what they will say. So you have to understand how the system works, how it, it's going to evolve, and then take a proper guess. Even though it is risky, certain things are meant to be done in a proper way. But if my husband had a chest pain or a shortness of breath, even I would have gone for a stunting, right? So if nothing is there, you should be careful and you should stop all this. Let me stop the recording.